Hey, Juan here over at Santos Counseling. So I appreciate that you're here with me, and we're going to get into what is family counseling. And I really want to break the ice so that it makes sense. It makes sense why families reach out to counselors, and I'm going to share more of what we do here at Santos Counseling so that it makes sense. Family counseling is a little bit different than individual counseling because individual counseling, if you haven't seen that video before, it's just one-on-one setting. Now with family counseling, it still follows a lot of that same procedure. The same procedure meaning that a family reaches out to the counseling office, let's say they reach out to Santos Counseling, and then they kind of share their story, what's going on. And then from there, we see which counselor really fits them. Maybe they share that some anxiety is taking place with a child, or test anxiety, some sort of mood challenges. So we really want to make sure that the counselor fits with the family system so that they're able to achieve the goals that brought them into counseling. After that point, we go into, what does the setting look like as far as family counseling? And then here we're actually at the office, which I wanted to do the video here so that it makes sense. Right, in the office, it would be the counselor sitting on one of those chairs back there, and then the family sitting in there. Now, again, it's connected to what that presenting issue. So that this video makes sense, I kind of want to paint you a picture. Now, let's say that a family, right, mom and dad and the child, reached out to the counselor. They reached out to Santos Counseling, and they're reaching out and they're saying, "Hey, listen, Juan, our son, he's 15 years old, and he's just having a hard time with testing. He goes in there, he's studying his butt off, but he's kind of just not being able to retain that information. And then when he takes the test, he's just testing, really low compared to, how intelligent we think that he is." So we really want to see how counseling can help him, how counseling can help us as parents to be able to address the issue, right? So as a side note, so far you kind of get that. So far you get what that presenting issue is. The presenting issue is that anxiety taking place, and it's connected to the school, right, with those tests. And then we also know that the parents want to know what they can do to help with the issue, right, to help address it. And then we know that the child, that 15-year-old, he wants to know, how do I address this too? So then we look at, okay, what do these sessions really look like back here? And then what they look like is that we have what's called some sort of plan, a plan to address the issue, right? The issue is we want to get better with the test and we want to lower the anxiety. So the plan's going to address that. And then we're going to have some kind of objectives and we're going to have goals so that as we move forward, things are making sense. As we move forward, the 15-year-old, he knows how to address the issue, and then also the parents, they know how to address the issue. So then I'll kind of paint you a picture so you kind of have an idea of what it looks like in here. A typical session could be that all of them are in there, the whole party, right? So we got a whole party back there going on. And it would be that we go into a conversation of, what does it feel for the child to go through that anxiety? What type of emotions take place? And I think it's important to do that so the parents can really see it. They can really understand it. And then we look at, well, parents, tell me how you communicate with your child about the anxiety. And then if they're communicating in a healthy way, we promote that. But if they're communicating in a way that's not healthy, maybe that's not constructive, then we look at addressing that. Because overall, we want to be able to support the parents so that they can parent in a really healthy and positive way to support their child. And then we want to support the child to be able to address the issue and be able to communicate with their parents and everyone else in their environment on the type of support that they need to be able to address the issue. And then moving forward, some of the sessions can change. Sometimes it could be the counselor and the child by themselves in that one-on-one, and then sometimes it could be the counselor and the parents in that setting, and then sometimes all together. It really just depends on, what kind of goals the client's coming in with, the family's coming in with, and then how that counselor sees those goals and how they want to work at it together. But overall, what I share with individuals is that in a family setting versus an individual setting, individuals one-on-one, right, it's just you and that counselor. And then in a family setting, it's a lot more parties. It's you, maybe your child, maybe your partner, more individuals. But overall, you're looking at, what brings you in, what's going on, and then how do we address this issue. So I hope that this video is helpful. I hope that it kind of paints a picture as far as what does family counseling look like, also called family therapy. And then I hope that if you do find yourself having any questions, maybe you're still kind of a little bit stuck, you're always more than welcome to email me at juansantos@santoscounseling.com. I'd be more than happy to answer any questions that you may have. Take care.